Well, welcome everyone. Good afternoon. I think we'll give it one more minute in case we have a few folks who are still joining us. We'll give it one more minute and then we'll get started. Thank you all so much for being here today. I think we will go ahead and get started. We don't want to take up your afternoon more than we really need to. Welcome to the information session for those of you who are interested in applying to be a pilot site for an upcoming field test that we're going to be engaging in around respite provider recruitment and training. My name is Jill Kagan, and I'm the director of the ARCH National Respite Network and Resource Center. And I'm joined by my colleague today, Lisa Schneider, who's the executive director of the Respite Care Association of Wisconsin. Just a very quick overview of what we hope to cover today. After introductions, I'll do a quick overview of the larger grant project that we're involved in. Talk a little bit about the expert work group that's assisting us in this effort. Share with you the draft core competencies for respite care professionals that we have so far developed. And then I will turn it over to Lisa to talk more about the respite care provider training itself and walk you through the timeline for the pilot project and the application. It would be great if all of you could just write in the chat your name, the state you're from, and maybe what agency or organization you're representing today. That would be very helpful for us. And in terms of our team, who not all of whom are with us today, again, I've introduced myself as Jill Kagan and Lisa Schneider, who's with me. Lisa has working with her Val Madsen, who's also with the Respite Care Association of Wisconsin. And if you're selected as a pilot state, you'll be working a lot with her because she's the training guru over there. We're also really privileged to have Kim Whitmore at Marquette University, who's going to be doing the evaluation of the pilot test, and her colleague Tyler Engel. And then we are very fortunate, and I'm going to talk a little bit more about our partnership with the National Academy for State Health Policy, but we're privileged to have Wendy Fox Grage advising us in this effort as well. And I think she might even be with us today. So welcome, Wendy. Just a really quick overview of the project. Last year, the National Academy for State Health Policy and ARCH applied for a Lifespan Respite Special Projects Grant from the Administration for Community Living. And the National Academy and ARCH were successful in that effort. NASHB is the lead on the project. And overall, there are three components of the project. One is the Respite and Direct Care Workforce Initiative that ARCH and the Respite Care Association is working on. Then NASHB will also be working on some major initiatives around state respite system planning and development. And then looking also at natural supports for respite and helping states support family caregivers in accessing those natural supports. The overall large goal for the project is to support and foster state and national efforts, including those of the RAISE Family Caregiving Advisory Council, in promoting access to respite for family caregivers. I just realized you're not seeing my screen, are you? Are you seeing it? Okay, great, sorry. Talking about the Respite Care Provider Recruitment and Training Pilot Project, which is what ARCH is working on in conjunction and collaboration with the Respite Care Association of Wisconsin. This is the meat and the heart of the project that we're going to be talking about today. The objective is to develop, test, and scale a respite workforce recruitment, training, and retention program. And we're hoping that this effort will help improve the evidence base for respite care workforce training and recruitment to better meet the respite needs of families. In the first year, we've already accomplished quite a bit. We spent a lot of time developing core competencies that would be specific for the training of respite care providers. There are lots of training curriculum and other evidence-based frameworks that are out there for training direct support professionals, and we identified all of those through an environmental scan and pulled from that what we thought might be core competencies specific to respite care providers. We then convened an expert work group that helped us review all of those. Those core competencies will then be aligned with a wonderful online training curriculum that the Respite Care Association of Wisconsin already has in place. And we'll be aligning that training to make sure that it reflects the core competencies that we are developing. And then right now we're still in year one and we're preparing to pilot the training. And we're expecting that we may be lucky enough to receive some additional funding from ACL. So we're now hopefully going to be able to increase the number of pilot states from 6 to 12. But we should know that for sure in another couple of weeks. In year two, once we've selected the pilot sites, those pilot sites will work in conjunction with the Respite Care Association of Wisconsin to create a recruitment and marketing campaign. This is really an important part of the project because without providers to take the training, we won't be able to test it. So that's going to be a major initiative, and that'll get started right away at the beginning of once we've identified and selected those pilot sites. During year two, we'll also be working with our evaluator to develop and refine the survey instruments and begin conducting the field test. The actual field test will be for 12 months, so that'll run into year 3 of our project. And once that's completed, we have about 6 months remaining in the project that we'll use to analyze the results from the field test and complete an evaluation report, and then develop an online replication toolkit with lessons learned so that we can, if this is a successful effort, we want to be able to share it with states across the board. I just wanted to quickly share with you the members of our expert work group because I think this really contributes to the validity of the core competencies that we're talking about and helps elevate those competencies to a greater national recognition. We did have members from national organizations, including Anchor, the Elder Care Workforce Alliance, PHI, and Family Voices. We were also fortunate to have 3 of our state respite coalitions represented, those 3 names in the middle squares there, rectangles, and then also some direct care workforce providers who are also members of Anchor. So we had lots of wonderful expertise and guidance as we were developing these core competencies. The expert work group was responsible for looking at all of the core competencies that we pulled from an environmental scan and from the training curriculum and evidence-based frameworks that we identified. They then advised us on which core competencies should be used to enhance the current Respite Care Association of Wisconsin's training. And where we are right now with the core competencies, we've completed that environmental scan that I talked about. We identified from those national training curriculum and state training curriculum that have been well adapted, and some of those training curriculum themselves were evidence-based, so we're pulling from those. The expert work group we had several meetings over the course of the year, reviewing them and identifying them. And then most recently, we took the core competencies that we had developed and disseminated them very widely for public comment, and we received over 200 very substantive, wonderful comments that were extremely helpful. And just very recently, the evaluator that we're working with took those comments and incorporated them into the next draft of the core competencies. So they're very close to being final. Our expert work group is in the process right now of reviewing those one more time. Once we have finalized those core competencies, they will be crosswalked to the respite care provider training at the Respite Care Association of Wisconsin, and their training will be modified to ensure that what we're delivering to all of you is a competency-based, nationally recognized competency-based respite care provider training. And these are the actual competencies. It still says proposed because we don't have the final yet. We hope to have that by next week once we've heard from all of our expert work group members. But they generally fall into these categories. And again, they differ from direct support professional competencies in that we really feel we identified those that are specific to the type of work and support that respite providers are offering to family caregivers. So the competencies are principles of respite, person and family centered care, cultural competency, which includes linguistic competency, communication and relationship building, health and wellness, safety and emergencies, planning respite activities, ethics and professionalism, professional development goals for respite providers, and then finally self-care for the respite care providers themselves as they undertake this as a career opportunity. Whoops. Now I'm going to turn it over to my wonderful colleague, Lisa, who's going to talk more about the respite care provider training and walk you through the application. So it's all yours, Lisa.
Have to unmute. Hi, everyone. So happy to talk about this project. We're so excited. So currently, Respite Care Association of Wisconsin has a respite care provider training curriculum that we offer here in Wisconsin. It's free, it's core competencies, and sorry, I thought that was on my end, Jill. I'm like, what is on my screen?
Sorry about that.
So anybody, our training is free. It was actually kind of approved by the state because it met the training under our CLTS program, which is our more restrictive respite care training requirements. And so we do have it online with a third-party platform. It's called Talent LMS, and people can access this training when they sign up for it. We put them into the training course, and then at their own pace, they can continue on with the training. They have usually up to 2 weeks, and at that point, we start to nudge them to say, you know, are you running into an issue, or can you kind of wrap it up for the most part? So we do try to keep things moving along. We also do pre and post testing in regards to each. You'll identify those core themes for the curriculum. So there's a pre and post test of each of those courses so that we can measure the improvements in knowledge that happened. And that's something that's going to carry forward with the pilot project as well. Next slide. So as for the pilot project, we're going to go into some details as to how that is going to go. There's three main strategies that we're focusing on here and what we're looking for in partners as well. So the pilot project itself, the three main strategies are recruitment. We're going to develop a targeted, comprehensive, effective recruitment campaign to reach individuals interested in providing respite care. And here, once we select the states that are going to participate in this, we're going to work together as a group. So we're not going to be here to prescribe to you what you need to do. We're going to kind of come up with that together, but we do have some information that we will share with everybody that is somewhat evidence-based and that we can build off of that. But we just realized that everybody's going to have their own kind of marketing teams, where as a nonprofit, we can kind of do our own thing. States might have a little bit different way of doing things, but we want to ensure consistent messaging. So that's something that we will work on together. The training, again, much as Jill said, that's a big component. So we're going to recruit, we're going to train, and give them access to the online training that they can take at their own pace. And then after that, we're going to focus on retention and culture. So we'll develop tools to help create a workplace culture that provides long-term retention and returns respite providers into respite ambassadors for the services provided. So those are the three strategies: recruitment, training, retention, and culture are the big focuses. Next slide. So the eligibility criteria for the applicants are applicants to be state respite or caregiver coalitions, government agencies, academic institutions, regional or statewide nonprofits, but we want to make sure that we're working with organizations that, whether through partnerships or collaborations, have a statewide reach. We're also looking for applicants that have experience in providing respite care, providing respite for multiple age groups or across the lifespan, and that the applicants have supports and collaborative partnerships to, again, have that statewide reach. We're also looking for applicants that have the capacity. So we're looking for experience, capacity, so that people who are ready to hit the ground running. That's in regards to readiness. So you need to be able to do the work and be able to hit the ground running in order to do the work. And then hopefully, once we've gone through this, you have the choice that we believe that this is going to be a sustainable project once it's done. So again, we're looking for applicants that have the experience, capacity, and the readiness to do the project, because we're really under a time crunch in order to do all this field testing. So once we hit, a lot of the planning will happen between once we make the award notifications and up until January 1st of 2022. At least this is the plan right now. So from January to 22, December of 22, that is literally when we're going to be implementing and carrying out the pilot project. Next slide. So here's the, let's see, would a demo. All right, so would a dementia-specific respite center be eligible? Again, we're looking to cover the lifespan and statewide. So I don't know if that answers your question, but it will be beyond just a dementia-specific focus. It's going to be statewide and across the lifespan.
I would still submit an application because we are looking for statewidedness and a lifespan approach as a priority. But if you can come up with something that's really wonderful, we'd still love to see it and take a look at what you have to offer.
Absolutely. So then we'll take a walk through the application. So for the most part, again, we're looking for the geographic and population reach. So these are a couple of the questions that are on the application. We're looking to have you describe your agency and your coalition's geographic outreach. Is it regional? Is it multi-county? Is it statewide? We're also looking for you to describe your target audiences, including the ages, conditions, disabilities of care recipients, and how you currently connect with them. Next slide. In regards to capacity and experience, these are a series of questions that we're asking you to reply to, such as if your agency or coalition currently conducts respite provider recruitment and training, and if so, describe how your agency or coalition supports collaborative partnerships to develop, enhance, and coordinate community-based respite care services. How does your agency coalition connect or match respite care workers with families seeking respite? How does your agency coalition help connect respite care workers with training opportunities to expand the pool of trained respite care workers in your state? Please describe policies, partnerships, and/or respite funding entities that will support your involvement in this project. And please name some existing funding and other relevant partnerships that will help ensure sustainability after the pilot project's completion, and describe how they will do so. But there's a lot of questions there in regards to capacity again. So we are really looking for, again, anybody and everybody can apply, but we're looking for folks that are pretty much ready to hit the ground running and have the ability to carry out this project. Next slide. And in regards to the readiness, we're looking for to demonstrate, does your agency or coalition have the ability to accept federal funds for involvement in this project? You'd be amazed how hard it is for some entities to receive federal dollars. It's amazing. Institutes of higher education, especially. Do you have dedicated staff available to participate in the pilot project who can attend bi-monthly meetings, conduct data collection efforts, and submit data reports? So this is going to be something that we will be working together, especially in the build up to the implementation of the pilot project. So there will be some commitment in regards to time so that we can all be on the same page with what we're doing. Can your agency or coalition execute a contract within 30 days from notification of the acceptance of the pilot project? Again, I know working with some states, contracts can kind of go into the black hole and you don't see them for a while, but we're looking to at least have some semblance of, yeah, when we're notified, we should be able to enter into a contract within 30 days. Also asking for you to describe how familiar you are with your state's respite care training requirements across state agencies and serving various ages and disabilities. So we're looking for, what we're working on is that common core curriculum, that universal core curriculum. It's entry level, it's basic, but it's going to be common at a national level. What we're looking for you guys to do is to be aware and understand your specific state requirements that are over and above, that are required, that are over and above the core curriculum that we will be providing. So when the states are participating in this, we will provide you with the core part of the training, but we'll also include some templates in there so that you can add your state specific training requirements as well. And it'll all be fed into the same training. So when people access the training from your state, it'll be very seamless. So we're also asking you to quickly, how you will quickly generate additional training modules in a relatively short period of time. Again, if necessary, to meet your state specific training requirements. So we want people to have somewhat of a familiarity or at least know where to go so they can get the information fairly quickly. So in regards to the budget, we're right now looking at awarding $7,500 to utilize the grant funds towards developing a marketing tools, recruiting providers for training, implement, promote, and field test the training, and to capture data. You will not have to budget for the monthly costs of accessing the training platform. That will all be covered as a whole by the grant. So you don't have to worry about that. So pretty much the line items you see over on the right are the kind of categories that you can look to utilize how you would spend that $7,500. And so that's totally up to you how you want to do it. Again, when we go back to what the marketing campaign will be, we will still be doing something consistent with our messaging. So how you go about it or what methodologies you use might be one thing, but the messaging we do want to be somewhat consistent. Next page. So here it is in a nutshell, the timeline. It's really complicated when you see our master sheet. We've kind of compiled it down here that the pilot project applications are due by midnight on 9/13/21. We're hoping to review and have the project entity selected by 10/1. During that time, we will be looking to execute the contracts, but also once you are aware, starting 10/1, that you've been selected for the pilot project, we will be having meetings already even before the contract is signed so that we can start focusing on one, just meeting to go over the general idea of the pilot project. We also want to start kicking into gear the partner states working together to create a recruitment and marketing campaign, establishing timeframes, goals, messaging, etc. And we hope to have probably a bi-weekly meeting thereafter until we are satisfied with our game plan. On 11/15, that is the deadline that we're hoping we will, in that time frame beforehand, be giving you access to the core curriculum along with the blank templates for you to add your state-specific training requirements. And from the date of notification from 10/1 till 11/15, we're hoping that states or applicants will be able to identify and build into those slide decks their state-specific training requirements. Because the goal is to hit the ground running starting 1/1/22. A lot of this stuff has to happen between you learning that you are a pilot project partner and when we hit the ground running come January 1st. We will provide, we're really lucky again with Val, who is the one that has really initially developed the core curriculum that we have as Respite Care Association. She's also going to be modifying it based on what we're working with the National Expert Work Group and the core curriculum information that we've learned through that whole process Jill talked about. But Val is also a guru on the platform that we host our training on. So we don't have to go to somebody else for technical assistance. We've got Val right on hand all the time. So we're really lucky in that realm. Not only is she the training specialist, she's a guru at the platform as well. And so Val will be, before January 1st, setting up one-on-one TA meetings with all the pilot project partners. And then once between January of December of next year, that's when we're just implementing the project. And then starting January of 2023 till September of 2023, that's when we're going to be doing data collection, evaluation, analysis, and the replication toolkit that will be available to everybody after we're all done with this. So I think that's for right now. Jill's site, you see the link down here below, is where you'll find more information in regards to this project and a link to the application that you can that you need to use to apply. If you have any questions, that's my and Jill's email addresses, and feel free to reach out whenever if you have any questions. And I think that's it. Are there any questions out there or anything else you want to add, Jill?
No, I think you did a great job, Lisa. I do. We do have another question asking if the respite that's covered would also be for those who are working with kinship caregivers and grandparents raising grandchildren. Again, we're really hoping that those who are applying will have a statewide reach, will have multiple partners, and that you will be serving, hopefully across the state, all respite care for all age groups and conditions. So while your specific agency might have some expertise, are you able to partner with others so that you have this lifespan approach to respite provider training? Those organizations that are able to demonstrate that will have priority, but again, we're not saying right off the bat, don't apply until we know what kind of partnerships and collaborations you can bring to the table. I did post the, there's a question about having the slides. I did post the slides in the chat. I can do that again for those of you that may have missed it. I do want to emphasize, and I think Lisa did emphasize this again, that given that we're getting a couple of questions about specific conditions, that this training really is for entry-level companionship type respite care providers. We will make every effort to assist those who are doing the online training if they're interested in continuing education or more specific training related to dementia, for example, or specific training related to certain disabilities, that we can help access those additional training modules. Or if you already have some in your state that are developed, for example, specifically to work with individuals with intellectual and developmental disabilities, that you maybe have some modules that will address specific conditions that have requirements, training requirements already in place that you want to be able to meet. So I did want to emphasize that. You'll be getting lots of support moving forward from our evaluation consultant in the data collection. You don't have to worry about developing the tools or the measurement tools to collect the data. The platform itself already collects a lot of data, and we'll be building on that to make sure as we move forward that we're collecting the best information that will demonstrate that this is a training that works across states, across populations, across age groups. So I just wanted to emphasize some of the points that Lisa did make already.
And thanks on the data, Jill, because Talent LMS, which is the third-party platform that hosts the training, it generates a lot of great data already. So we will easily have apples to apples data to compare, but there will be some additional data that we will be collecting that won't be provided by the Talent LMS platform. All right, so Jill just plugged in the slides on there so that you guys can use as reference for completing the application, because I saw somebody mention that above. I'm
also going to be posting again the link to the website that has very much more detailed instructions on how to complete the application. So it's not too difficult. It's really best if you're going to work on the application that you draft all of your responses in a Word document and save that. Because once you start the application, you cannot save it and come back to it later. So you need to be prepared to cut and paste all of your responses into the application once you've opened it up and get it done in one sitting before you submit it. So that's important. We have on the link that I am we'll be posting in a minute. There is an information packet that has all the questions, so you can actually see the questions in advance while you're working on it and developing your responses in a Word document. And this is the website to access that information if you want to see that in advance. It also has the application portal to get to the application itself. So all the information you need is on that most recent link that I just posted. Any other questions? Feel free to unmute yourselves. We don't really have that many people on the call today. So if you'd like to unmute yourselves and ask a question, we'd love to hear from you. And I'm going to stop sharing my screen so that maybe we can see more of you. Feel free to turn on your cameras and unmute yourselves. Hi, Wendy.
Hey, Wendy. So is there anybody out there that is seriously considering applying for this? So you can either raise your hand or put a yes in the chat or say something. Okay.
So one hand.
One hand. There we go.
I see we have a couple of our Lifespan Respite grantees in the audience too, so that's wonderful to see you. Welcome.
All right.
Is quick question, is group respite appropriate for this?
You mean in regards to training a group of people?
So the program that I work for, we're a dementia specific adult day program.
Okay. Again, I think what this is meant to be, and I'll give a great little story. We have a very rural set of counties in Northwest Wisconsin. And the whole idea with this project is to build worker availability to meet the needs of caregivers and care recipients, because we're just in workforce crisis in regards to the caregiving industry. So with the folks up in Northwest, the counties up there, they did a recruitment training and retention program where they had nobody up there that were on our registry for anybody to find. They had 0 workers in their area. They used a grant that we had. They did outreach, recruitment, brought people in to access our training online. And then those people, when they completed the training, they actually created profiles and they're available for workers to work in that area. So in a couple of months, they went from 0 workers to having 11 trained workers listed in those rural communities that didn't exist before. So that's kind of the whole plot behind this, is to create care capacity or expand the pool of respite care workers, trained respite care workers. So it's not for like a particular agency or a particular program per se. Did I answer your question, Shannon?
You did, thank you.
I mean, I think, definitely the training would be, could be very useful for your particular agency in helping you recruit providers. But in terms of pilot testing this, we're really looking for pilot sites that will be able to test the curriculum statewide among multiple agencies, across ages and disabilities. If perhaps your agency wanted to take the lead in recruiting other partners that are serving other age groups and other conditions, maybe partnering with some area agencies on aging or with the Family Voices chapter in your state, or if you have a state respite coalition, joining forces with a coalition that's already in existence. That would be the type of pilot site that we're looking for to test this particular training curriculum so that we'll know about the statewidedness and the reach of this training. And again, because it's just entry level, it depends on what your particular agency is in need of. If you need something beyond just entry level training, but you were able to add modules to it that were helpful, that certainly is a possibility. But again, it's not designed just to be training for your agency, though hopefully at some point, if we're able to develop this competency-based training that's available for everyone, it could certainly be used that way. But for the purposes of this pilot test, again, we really wanted to have a statewide or at least a multi-county reach so that we're adequately testing how valuable it is across ages and conditions.
Jill, what about possibly like high schools and technical colleges, community colleges, things like that? We were kind of thinking about that.
Certainly to recruit for people to take the training.
Okay.
Absolutely. And yeah, we'll get into that as everyone sits down to talk about the recruitment and marketing campaign, to talk about the best places to look for potential people to take the training. I mean, that's going to be really critical. You might have this wonderful training in place, but if we can't find the people that are interested in taking the training, we won't be able to pilot test it either. So having those great ideas about where to recruit folks from is a great way to start.
Absolutely, absolutely. And that's a lot of what we're going to be testing is, you know, who's responding to our marketing tools. Are we getting who we thought we were going to get? And maybe we need to make some adjustments. So we're always going to be trying, testing and measuring so we can really evolve this into something that is very evidence-based and is proven. So it'll be a lot of, I look at it and I'm very excited about it. And when you talk about the core curriculum as an agency, this is just one thing that we're taking on. And some of you may have other things that your agencies do. So like for people who complete our training program, we do have very issue-specific training that people can continue on and take for free. This whole thing is really focused on that core curriculum and trying to have a universal national standard that at least it meets this core part, and then you can add to it whatever the state-specific requirements are. So that's where that is.
Any other questions or comments? Well, please, take the time to perhaps go to the website link that we've given you, spend a little more time reading about the background and the content of the application. If you think of a question once we hang up, please feel free to contact me or to contact Lisa at any time. And we're very happy to answer your questions. And you can find our email addresses again on the slides that I posted the link to as well.
And also feel free to go onto our website, Respite Care Association of Wisconsin, to just get an idea, go onto our training. And you can just kind of get a better idea of what we're talking about in regards to the training. Now, it's something, what you will find is something that's going to be modified, but what we've learned from the public comment process and our expert work group, but it's what we have right now that people are still in the process of using in training. So you'll be able to see like the process that you can sign up. You can take a look at all the training that we have that's part of that curriculum. You can also see some of the other trainings that we have. So it'll maybe give it a little bit more context than what we have provided for you today. So if that helps, feel free to go check it out.
Well, if there are no additional questions, we can give you back part of your afternoon today. Again, don't hesitate to reach out to us if you think of something once we disconnect from the call. We're really excited about this. We want to encourage as many folks to apply, even if you're not totally sure that this is appropriate for your particular agency, take a look at the questions. And you'll get a better idea of what we're looking for in terms of pilot sites. And those folks that are going to be able to help us test this recruitment and training curriculum.
Yeah. Sounds good. Thanks, Jill.
last
Thanks,
words,
everybody.
Thank you.
All right, thank you, everyone.
You guys.
We hope to get your applications.